Hello everyone, and welcome back to my channel. Thank you for joining us today. It's a pleasure to be here with all of you as we delve into a topic that plays a critical role in modern medicine and the preservation of human life: angioplasty and angiography. Angioplasty and angiography are vital procedures used primarily to diagnose and treat cardiovascular diseases. Starting with angiography, this technique involves the use of imaging technology to visualize the inside of blood vessels. By injecting a contrast dye and taking X-ray images, doctors can identify blockages or abnormalities in the arteries. This diagnostic step is crucial. It allows healthcare providers to assess the condition and extent of any vascular issues. Now, moving on to angioplasty, this is a minimally invasive procedure often performed in conjunction with angiography. During angioplasty, a small balloon is inserted into a narrowed or blocked artery and then inflated to open up the vessel, improving or restoring blood flow. In many cases, a stent may also be placed to help keep the artery open in the long term. Together, these procedures have revolutionized how we approach heart disease, saving countless lives by allowing timely intervention in cases of coronary artery disease. By improving blood flow to the heart and other vital organs, angioplasty and angiography not only alleviate symptoms but also significantly reduce the risk of severe complications like heart attacks. Today, we'll dive deeper into how these procedures work, their benefits, and advancements in technology that continue to enhance their effectiveness. Let's get started. Angioplasty is a medical procedure used to open narrowed or blocked blood vessels, particularly arteries, which supply blood to the heart. In the case of coronary angioplasty, it's commonly used to treat coronary artery disease, which can lead to heart attacks or other heart issues if untreated. Facts about angioplasty. 1. Purpose: angioplasty helps restore blood flow to the heart by widening narrowed or blocked arteries. 2. Minimally invasive: unlike open heart surgery, angioplasty is less invasive and often involves just a small puncture in the skin. 3. Catheter-based: the procedure relies on a catheter, a thin, flexible tube, to reach the affected artery. 4. Balloon and stent: a small balloon is inflated inside the artery to widen it, and often a stent, a small metal mesh tube, is placed to keep the artery open. 5. Quick recovery: most patients can return to regular activities within a few days to a week. 6. Performed in cath lab: this procedure is typically done in a catheterization laboratory, cath lab, instead of an operating room. 7. Sedation and local anesthesia: patients are awake but sedated, with a local anesthetic at the insertion site. Detailed process during angioplasty. 1. Preparation. Sedation: the patient receives a sedative to stay relaxed and a local anesthetic at the puncture site, often the wrist or groin. Accessing the artery: a small puncture is made in the wrist or groin, where a catheter is inserted. Contrast dye: to help visualize the arteries, a contrast dye is injected through the catheter. An X-ray angiogram shows where blockages are located. 2. Balloon angioplasty. Guiding the catheter: the catheter is guided through blood vessels to the site of the blockage. Inflating the balloon: once at the blockage, a small balloon at the catheter's tip is inflated, which compresses the plaque against the artery walls and widens the artery. Deflating the balloon: after a few seconds, the balloon is deflated and removed, which may be repeated to ensure the artery stays open. 3. Stent placement if needed. Stent deployment: often, a stent is placed on the balloon and expands when the balloon inflates, embedding the stent in the artery wall. Securing the stent remains in place as a scaffold to keep the artery open after the balloon is deflated and removed. Types of stents: drug-eluting stents, which release medication to prevent re-narrowing, are commonly used. 4. Final steps. Removing the catheter: the catheter is slowly removed once the artery is open. Monitoring: the puncture site is carefully bandaged, and the patient is monitored for a few hours to a day to ensure there's no bleeding or complications. Recovery: most patients are discharged within a day, with instructions to avoid strenuous activities and to follow up with their doctor. Post-angioplasty care. Medications: patients may need blood-thinning medications to prevent blood clots from forming around the stent. Lifestyle changes: a heart-healthy diet, exercise, and avoiding smoking are crucial for long-term success. Follow-up: regular checkups and possibly a stress test to ensure arteries remain open. Angioplasty can be a life-saving procedure, especially for those at risk of heart attacks, and has a high success rate when performed promptly and with proper post-care. Certainly. Both angioplasty and angiography are essential procedures in cardiology, often performed together to diagnose and treat coronary artery disease. 1. Angiography: diagnostic imaging of blood vessels. Purpose: a angiography is a diagnostic test that uses X-ray imaging to visualize blood vessels, typically to detect blockages or narrowing in arteries, especially those that supply blood to the heart, coronary arteries. Steps in the angiography procedure. 1. Preparation. The patient lies on an X-ray table in the catheterization laboratory, cath lab. Sedation is given to relax the patient, though they usually remain awake. A local anesthetic is applied to the insertion site, usually the wrist or groin. 2. Catheter insertion. A thin, flexible tube, catheter, is inserted through a small incision at the insertion site. The catheter is carefully guided through blood vessels to the heart using fluoroscopy, continuous X-ray imaging. 3. Injecting contrast dye. Once the catheter reaches the targeted artery, a special contrast dye is injected. This dye makes the blood vessels visible on X-ray images. The patient may feel a warm sensation as the dye is injected, which is normal and temporary. 4. Capturing images. X-ray images, angiograms, are taken as the dye flows through the arteries. These images show any blockages or narrowing in real time. Based on these images, the doctor determines the severity and exact location of the blockages. 5. Evaluating the results. If blockages are found and deemed treatable, the doctor may proceed immediately to perform angioplasty. 2. Angioplasty, restoring blood flow in narrowed arteries. Purpose: is angioplasty, often performed after angiography confirms a blockage, is a treatment that opens up narrowed or blocked arteries, particularly in the heart. It is often combined with stent placement to keep the artery open long-term. Steps in the angioplasty procedure. 1. Positioning the catheter. If angioplasty is needed, the doctor uses the same catheter or may replace it with a specialized catheter that has a balloon at the tip. The catheter is maneuvered through blood vessels, guided by fluoroscopy, to the location of the arterial blockage. 2. Balloon inflation. When the catheter reaches the blockage, the balloon at the catheter's tip is carefully inflated. Inflating the balloon compresses plaque, fatty deposits, against the artery walls, widening the artery and restoring blood flow. The balloon inflation typically lasts a few seconds to a minute, and this process may be repeated as needed. 3. Stent placement if necessary. In many cases, a stent, a tiny, expandable metal mesh tube, is placed over the balloon and positioned in the blocked area. When the balloon inflates, it expands the stent, which locks into place inside the artery. Once the balloon deflates and is removed, the stent stays in place to keep the artery open. Stents can be bare metal or drug-eluting, releasing medication over time to reduce the risk of re-narrowing. 4. Final balloon deflation and removal. After the artery is opened, the balloon is deflated, and all catheter equipment is removed. Pressure is applied to the insertion site to stop bleeding, and sometimes a special closure device is used to seal the puncture. 5. Monitoring and post-procedure care. The patient is monitored in a recovery area for several hours, often overnight, to ensure there are no complications like bleeding or clot formation. After angioplasty, most patients are prescribed blood-thinning medications to prevent clotting around the stent. Patients may be advised to make lifestyle changes, such as adopting a heart-healthy diet, regular exercise, and quitting smoking if necessary, to maintain long-term results. Key differences between angiography and angioplasty. Angiography, diagnostic procedure to identify blockages by injecting contrast dye and taking X-ray images. Angioplasty, treatment procedure to open narrowed arteries, often including stent placement to maintain blood flow. Both procedures are typically low risk and can be life-saving by restoring blood flow and reducing the risk of heart attacks. It is possible to have angioplasty more than once. Some patients may need repeat procedures if they experience recurrent narrowing or blockage, known as restenosis, in the same artery or if they develop new blockages in different arteries over time. Reasons for repeat angioplasty. 1. Restenosis. Although modern stents, especially drug-eluting ones, have greatly reduced restenosis rates, the artery can sometimes narrow again after a period of months or years. This can be due to scar tissue forming around the stent or new plaque buildup. 2. New blockages. Coronary artery disease is a progressive condition, so new blockages may form in other areas of the coronary arteries, necessitating another angioplasty. 3. Stent-related issues. Occasionally, blood clots may form around a stent, causing a new blockage. Blood-thinning medications are usually prescribed after angioplasty to reduce this risk, but it's still possible. Factors affecting repeat procedures. Type of stent used. Drug-eluting stents lower the risk of restenosis compared to bare metal stents, so the type of stent used may impact the likelihood of needing a repeat procedure. Lifestyle factors, smoking, a high-fat diet, physical inactivity, and other factors that contribute to artery plaque buildup increase the risk of future blockages. Underlying health conditions, conditions like diabetes and high cholesterol can increase the risk of artery disease progression, which may necessitate additional angioplasty. Alternatives to repeat angioplasty. If restenosis or new blockages occur, doctors may sometimes recommend other options. Coronary artery bypass grafting, CAB bypass surgery is often recommended if blockages are widespread or if there are repeated blockages that angioplasty alone cannot resolve. Medications and lifestyle management. In cases of mild restenosis, medication and lifestyle changes may be attempted first to avoid repeat angioplasty. Many patients undergo repeat angioplasties successfully, but each case is evaluated individually based on the person's health status and specific needs. Angioplasty is a very common and effective procedure for treating heart disease, particularly for coronary artery disease, CAD. It is one of the most frequently performed cardiac procedures worldwide and is used to relieve symptoms like chest pain, angina, and reduce the risk of heart attacks. Why angioplasty is commonly used for heart disease? 1. Minimally invasive. Unlike open heart surgery, angioplasty is a minimally invasive procedure that requires only a small incision, typically in the wrist or groin. This reduces recovery time, risk, and discomfort. 2. Immediate symptom relief. Angioplasty can quickly restore blood flow, providing immediate relief from symptoms like chest pain and shortness of breath. 3. Emergency treatment for heart attacks. Angioplasty is the preferred emergency treatment for heart attacks, especially if performed quickly. It can open the blocked artery responsible for the heart attack and restore blood flow, minimizing heart muscle damage. 4. High success rates. Angioplasty, particularly with the use of drug-eluting stents, has high success rates in keeping arteries open and reducing the likelihood of repeat blockages. 5. Widely available. Most hospitals with cardiology departments can perform angioplasty in a specialized cath lab, making it accessible to many patients. Angioplasty in the context of heart disease management. First-line treatment for some patients. For patients with significant coronary artery blockages causing symptoms, angioplasty is often recommended over medications alone. As part of a broader treatment plan, angioplasty is effective, but it is usually combined with lifestyle changes and medications to manage heart disease. This comprehensive approach helps prevent further plaque buildup and reduces the need for repeat procedures. Alternative to bypass surgery. For patients with fewer or simpler blockages, angioplasty is often chosen over coronary artery bypass grafting, CAB surgery, which is more invasive. Angioplasty has transformed heart disease treatment by providing a safe, fast, and effective method to open blocked arteries, often preventing more severe events like heart attacks. While angioplasty is highly effective and has a high success rate, it is not always successful in every case. The procedure successfully opens blocked arteries in approximately 90 to 95% of cases. However, several factors can affect its success. Factors affecting angioplasty success. 1. Severity and type of blockage. Soft plaque. Angioplasty is generally more successful when dealing with softer, newer plaque. Calcified or hard plaque. Older, calcified blockages may be more challenging to open with a balloon and may require additional techniques, like rotational atherectomy, a procedure that drills through calcified plaque. 2. Location of the blockage. Blockages in smaller or more complex arteries, such as those with multiple branches or sharp bends, can make angioplasty more difficult. Blockages in larger, straight arteries are generally easier to open with angioplasty. 3. Patient's health conditions. Conditions like diabetes, kidney disease, and advanced age can increase the risk of complications or reduce the effectiveness of angioplasty. Some patients may also have multiple blockages or extensive artery disease that make angioplasty less effective. 4. Recurrent narrowing, restenosis. While drug-eluting stents have reduced restenosis rates significantly, arteries can sometimes re-narrow after angioplasty. Approximately 10 to 15% of patients may experience restenosis within 6 to 12 months, necessitating further treatment. 5. Chronic total occlusion, CTO. In cases where an artery is completely blocked for a long period, chronic total occlusion, angioplasty is more challenging. These blockages may require specialized techniques or might be better suited to coronary artery bypass surgery, CAB. Alternative approaches if angioplasty isn't fully successful. If angioplasty does not successfully open a blockage or if restenosis occurs, doctors may consider other options. Coronary artery bypass grafting, CAB. This surgical procedure is often recommended for patients with complex or multiple blockages that can't be effectively treated with angioplasty. Medications. In some cases, medication therapy may be used as a long-term approach if angioplasty is not feasible. Lifestyle and risk factor management. Modifying lifestyle factors and managing risks like high cholesterol, smoking, and high blood pressure are critical to supporting any heart disease treatment. While it's not always successful, angioplasty remains a highly effective treatment for many patients, especially when the right conditions and patient profile are present. Angioplasty is generally safe, but like any medical procedure, it does carry some risks. Serious complications are uncommon, particularly with the advancements in techniques and equipment. However, understanding these risks can help patients make informed decisions. Common risks of angioplasty. 1. Bleeding or hematoma at the catheter insertion site. Bleeding at the puncture site, usually the wrist or groin, is one of the most common complications. Sometimes, a small collection of blood, hematoma, may form under the skin. Typically, this is mild and resolves on its own, but in rare cases, severe bleeding might require further treatment. 2. Blood vessel damage. The catheter or balloon may occasionally damage blood vessels, particularly in patients with fragile or heavily calcified arteries. This may require repair or, in rare cases, emergency surgery. 3. Blood clots. Blood clots can form around the stent after angioplasty, potentially leading to a blockage or even a heart attack if the clot moves. Blood-thinning medications are prescribed to reduce this risk, but it still exists. 4. Restenosis, a re-narrowing of the artery. There is a small chance, around 10 to 15%, of the artery re-narrowing after angioplasty, particularly if a stent wasn't used or with older bare metal stents. Drug-eluting stents have lowered this risk but don't eliminate it entirely. 5. Heart attack. While rare, a heart attack can occur during or after angioplasty, often due to dislodged plaque or clots. 6. Kidney damage. The contrast dye used in angioplasty can sometimes affect kidney function, especially in patients with pre-existing kidney problems or diabetes. To minimize this risk, doctors use the lowest effective dye amount and encourage hydration. 7. Allergic reaction to contrast dye. Some patients may have an allergic reaction to the contrast dye. Symptoms can range from mild itching or rash to severe breathing difficulties, though this is rare and treatable with medication. 8. Irregular heartbeat, arrhythmia. The procedure may trigger abnormal heart rhythms temporarily. In most cases, these are mild and resolve quickly, but on rare occasions, they may require treatment. 9. Stroke. Though rare, a stroke can occur if a clot dislodges during the procedure and travels to the brain. This risk is higher in older patients and those with underlying vascular issues. 10. Death. Death during angioplasty is rare, especially in elective procedures. However, the risk may be slightly higher in emergency angioplasties for heart attacks or in patients with multiple health conditions. Reducing the risks of angioplasty. Pre-procedure screening. Patients are thoroughly screened for risk factors, such as allergies to contrast dye or kidney function issues, to minimize complications. Medications. Blood thinners are typically given before and after angioplasty to prevent clot formation. Skilled team. Having an experienced cardiologist and support team in a well-equipped cath lab can significantly reduce risks. Follow-up and lifestyle changes. Patients are advised to follow lifestyle modifications, e.g., diet, exercise, and medication regimens to maintain artery health and reduce the chance of restenosis. Risk factors for complications. Complications are more likely in patients who have multiple, complex blockages, are undergoing angioplasty during an emergency, e.g., heart attack, have other health conditions, diabetes, kidney disease, high blood pressure, are older. Angioplasty's benefits often outweigh the risks for many patients, especially when it relieves symptoms or prevents a heart attack. However, understanding these risks can help patients have informed conversations with their cardiologists and make the best choices for their heart health. Emergency surgery due to complications during angioplasty is rare, especially with advances in equipment and techniques. However, in about 1 to 2% of angioplasty procedures, complications may arise that necessitate urgent intervention, such as emergency coronary artery bypass grafting (CABG). The exact rate varies depending on factors like patient health, the complexity of the blockages, and the expertise of the medical team. Reasons for emergency surgery during angioplasty. Emergency surgery may be needed if complications develop that can't be managed through catheter techniques alone. Key reasons include 1. Artery rupture or dissection. In rare cases, the artery may tear or split, dissect, when the balloon or catheter passes through a narrowed or calcified area. This can lead to reduced blood flow and may require immediate surgical repair if severe. 2. Severe blood clot formation. Sometimes, a clot may form rapidly around the treated area, blocking blood flow. While blood-thinning medications are given to prevent this, a large clot that can't be resolved through catheter-based techniques may require surgery. 3. Refractory blockages. If angioplasty fails to restore blood flow to a crucial artery and symptoms worsen, the patient may need emergency bypass surgery to ensure the heart receives adequate blood supply. 4. Sudden heart attack during angioplasty. Though rare, a heart attack can occur if a plaque fragment or blood clot dislodges and blocks an artery during the procedure. If this can't be managed in the cath lab, surgery may be necessary. Reducing the need for emergency surgery. 1. Pre-procedure planning. A thorough assessment before angioplasty helps identify patients at higher risk of complications, and doctors may plan accordingly or opt for CABG if necessary. 2. Advanced catheter techniques. Cardiologists now use advanced devices and techniques, like stent-assisted techniques or rotational atherectomy, for calcified blockages, which help avoid complications. 3. Experienced medical teams. Angioplasty, performed by experienced cardiologists in well-equipped facilities, tends to have fewer complications. Overall, emergency surgery after angioplasty remains an uncommon event, especially with careful planning and modern techniques. Recovery after angioplasty is typically faster and less intensive compared to more invasive surgeries, like coronary artery bypass grafting (CABG). However, proper care and lifestyle adjustments are crucial for long-term success. Here's a breakdown of what the recovery process looks like and what patients can expect. Immediate post-procedure recovery. 1. Monitoring in the hospital. After the procedure, patients are usually monitored in a recovery area or a hospital room for several hours or overnight. Vital signs are closely observed, and the catheter insertion site, wrist or groin, is checked for bleeding, bruising, or swelling. If there were no complications, many patients are discharged the same day, especially if the procedure was elective. In cases of emergency angioplasty or complications, a longer stay may be necessary. 2. Rest and fluid intake. Patients are encouraged to rest, particularly keeping the catheter insertion site still to avoid bleeding. Drinking plenty of fluids helps flush out the contrast dye used during the procedure, which is particularly important for kidney function. 3. Medications. Blood thinners and antiplatelet drugs, like aspirin and sometimes clopidogrel, are prescribed to prevent blood clots around the stent. Other medications may include cholesterol-lowering drugs, statins, beta blockers, or blood pressure medications as part of ongoing heart disease management. The first week after angioplasty. 1. Activity limitations. Light activities are generally allowed within the first few days, but strenuous activity, heavy lifting, and exercises that involve the insertion area, wrist or groin, should be avoided for about a week. Most patients can resume normal daily activities after about a week, though the timing may vary based on individual health and the complexity of the procedure. 2. Caring for the insertion site. The insertion site should be kept clean and dry, and any bruising or mild swelling should gradually improve. Patients are advised to watch for signs of infection, such as redness, swelling, warmth, or discharge, and report these to their healthcare provider. 3. Follow-up appointments. A follow-up appointment with the cardiologist is scheduled to assess recovery, monitor medications, and address any concerns. Blood tests or additional imaging may be performed to evaluate cholesterol levels, kidney function, or heart health. Long-term recovery and lifestyle changes. 1. Cardiac rehabilitation. Many patients are encouraged to participate in a cardiac rehabilitation program, which provides a structured, supervised exercise plan and education on heart-healthy habits. Rehabilitation can improve heart function, reduce symptoms, and lower the risk of future cardiac events. 2. Lifestyle changes. To prevent further artery blockages and improve heart health, lifestyle changes are essential. Key changes include healthy diet. Emphasize a diet low in saturated fats, high in fruits, vegetables, whole grains, and lean protein. Regular exercise. Gradual physical activity, like walking, can start within days of the procedure, but intense exercise should follow the cardiologist's recommendations. Smoking cessation. If applicable, quitting smoking is crucial to reduce the risk of artery disease progression. Stress management. Reducing stress through practices like mindfulness or therapy can benefit heart health. 3. Medication adherence. Continuing prescribed medications, particularly blood thinners and statins, is essential to prevent blood clots and keep cholesterol levels in check. Regular checkups with the doctor will help ensure medications are working effectively and that any side effects are managed. Potential symptoms to watch for during recovery. While rare, some symptoms may indicate complications that need immediate medical attention, such as severe pain or excessive bleeding at the insertion site, signs of infection, fever, redness, or drainage, chest pain, shortness of breath, or irregular heartbeats, swelling in the legs, which could indicate a blood clot. Full recovery timeline. Short-term recovery, 1 to 2 weeks. Most patients can resume normal activities, including returning to work if it doesn't involve strenuous physical effort. Long-term recovery, achieving optimal heart health is a lifelong process, often requiring regular monitoring, lifestyle adjustments, and medication management. The recovery process is typically smooth and many patients feel significant relief from symptoms like chest pain or fatigue following medical advice, and adopting heart-healthy practices can greatly enhance the benefits of angioplasty and reduce the risk of future cardiac events. After an angioplasty, you'll likely be prescribed a combination of medications to help prevent complications, support the healing process, and reduce the risk of future heart problems. These medications target blood clotting, cholesterol, blood pressure, and overall heart health. Here's a breakdown of the typical medications that might be recommended after angioplasty. 1. Antiplatelet medications, blood thinners. Aspirin. Aspirin is almost always prescribed indefinitely after angioplasty to prevent blood clots from forming around the stent. P2Y12 inhibitors. In addition to aspirin, a P2Y12 inhibitor, like clopidogrel, ticagrelor, or prasugrel, is usually prescribed for a set period, typically between 6 months to 1 year after the procedure, depending on your specific condition and the type of stent used. Dual antiplatelet therapy, DAPT. This combination of aspirin and a P2Y12 inhibitor is known as DAPT and is essential to reduce the risk of clots forming in or around the stent, known as stent thrombosis. 2. Statins, cholesterol-lowering medications. Statins like atorvastatin or rosuvastatin help lower LDL cholesterol, bad cholesterol, and stabilize plaque in the arteries, reducing the risk of new blockages. Statins also have anti-inflammatory properties, which help reduce overall cardiovascular risk, even if your cholesterol is already in a healthy range. 3. Beta blockers. Medications like metoprolol or atenolol may be prescribed to reduce the heart rate and blood pressure, helping to decrease the heart's workload. Beta blockers are often prescribed if you have a history of heart attack or heart failure, as they improve long-term survival rates and help prevent future cardiac events. 4. ACE inhibitors or ARBs. Blood pressure control. ACE inhibitors, drugs like lisinopril or ramipril, help relax blood vessels and lower blood pressure, reducing strain on the heart. ARBs. If you can't tolerate ACE inhibitors, angiotensin receptor blockers, ARBs, like losartan or valsartan, may be used instead. Both ACE inhibitors and ARBs can benefit patients with high blood pressure, heart failure, or reduced kidney function, and they help protect heart function over time. 5. Calcium channel blockers, if needed. Amlodipine or diltiazem may be used to lower blood pressure and help relieve chest pain, angina, by relaxing blood vessels. These are typically prescribed if beta blockers alone aren't enough to manage blood pressure or angina. 6. Other medications, as needed. Nitrates, short-acting nitrates like nitroglycerin, may be prescribed on an as-needed basis to relieve chest pain. Diuretics. If you have heart failure or high blood pressure that's difficult to control, a diuretic, like furosemide, may be prescribed to help the body get rid of excess fluid. How long will you need to take these medications? Antiplatelets. Dual antiplatelet therapy, DAPT, is generally needed for 6 to 12 months, after which you may continue with just aspirin long-term. Statins, beta blockers, and blood pressure medications. These are often prescribed for the long term to manage heart disease and prevent future issue. Some patients may need these medications for life. Importance of medication adherence. Sticking to your medication plan is crucial to prevent stent-related blood clots, lower the risk of repeat blockages and heart attacks, support overall heart health, and reduce the progression of coronary artery disease. Your cardiologist will work with you to tailor a medication plan suited to your individual needs, monitor you for any side effects, and adjust doses as needed. We'd love to hear from you. If you have personal experiences with angiography or angioplasty, please share them in the comments below. Your stories could provide valuable insights and support to others in our community. And don't forget to like this video, share it with friends, and subscribe to our channel for more informative content. Your support helps us continue to create valuable resources and share important health information. Thank you.